Okay, everyone. So let's continue our program. So now we are going to have a discussion about the last session that we have in this morning. So with Professor Celia and Professor Teresa. So please come to join us here for the questions.
So are there any questions for the presenters? If you don't, I think I can start because I do. So actually, I had a very good experience in Norway, as he commented. And one of the things that really highlighted me when I was there was that researchers were treated as having a job. And that's part of, it's a main challenge for us to have a data of quality, and to maintain these researchers doing quality research. So I wanted to ask both of you or your inputs on what is the impact of considering, for example, not a scholarship, but a salary, not having rights with having rights as a researcher, as a job position in a very formal position. Yeah.
I don't know if I can answer that, but I still remember, I'm trained as a clinical psychologist and I worked as a clinical psychologist for many years. And I have always loved school. So that was my arena. And when I started as a PhD student, I was a late academic bloomer. I remember one of the first days I was at work, I was reading and I was writing, and it struck me, I get paid to read and write and learn. It's an enormous privilege. And I couldn't do it without the salary, obviously. And of course, I earned less than I did as a clinical psychologist, but still the quality of life, everything. Yeah. So, but I feel very privileged to do so. Yeah.
Isabel, I'm not too sure that I fully understood your question, but I think you're talking about the differences between Brazil, academic careers.
I can rephrase this, because in Norway, PhD students are not students. They are considered as temporary staff. So they don't receive a scholarship. They receive a payment, a salary. So it's way more structured. And when I compared this, I saw that the researchers there, they were doing their PhD projects, but they had they were not attached, but they had a contract with the university. So it was a formal thing. And in my vision, it made everybody more committed to what they were doing. So the schedules and the commitment. So, and I think that impacts on the quality of our dedication inside of the research. And I wanted to.
It's interesting to know. Yeah, it's a bit different. There are some similarities but a lot of differences for New Zealand. Yeah, PhD students, they, well, University of Auckland is a paid institution overall. So we're going to have all kinds of setups for PhD students, from PhD students that are lucky enough to get the scholarship from the University of Auckland. And there are just a few scholarships, not many. And a lot of students who pay for their scholarships. But while they are PhD students, they can, and it's quite common that they can be also contracted to working usually in other projects for temporarily as research assistants casually. So they are treated as researchers as well, not students, if that makes sense. I don't know if I answer your question.
Yeah. Just wanted your opinion.
So many of us have to struggle with our IRB issues when we develop these cohorts. And it seems that there's a tension between wanting to create a sense of community among our participants, but at the same time, we're identifying them as participants in a study. And once you know that someone is a participant, once the data become publicly available, you can deduce identities of those individuals and get a hold of all of their data. So I was just wondering for your comments on the perspective of how you balance wanting this community of participants who, and they're known by the rest of the community as being part of the study, with the risks for breach of confidentiality.
in terms of our cohort, the participants have not consented to sharing of data. So it's only the members of the test group that can use the data. We cannot share the data publicly. So it's not, so that's why when Isabella is using our data, she has to be with us. So that's how it's in our, for our cohort. So the disadvantage is obviously that it's not open, but that's the way it was, yeah, due to the consent simply. And also because of the Norwegian laws and so forth, it's very restricted. Yeah. Yeah, but we have not a requirement to do that, but a lot of both journals and others, like we pre-register and we do that, but we always just note that it's not due to participant consent. The data is not publicly available. It's just a fact. So we haven't met any like problems in that respect. Yeah.
With growing up, well, the data is publicly available, but you need to apply for that. You need to go through data protocols, but in theory, it's for use of researchers. So that's one of the main things that the research team does in growing up, which is all that process of data management and and making the data available to end users, anonymize the data. But it's a good question, Johan, because so there are some protocols that you have to follow in New Zealand overall with many data sets, and with the growing up in New Zealand, which to do with obviously cell suppression or aggregation if you have cells with less than 10 participants. But I get totally what you say, and we have a lot of people, oh, my child participates in the growing up, and people feel they like to share they are participants of the study. So I totally get that. I don't know if I'm going to have the answer, but we try to implement those things in place in terms of data anonymization. And the data that's available is fully anonymized. And also the data is, when I say the data is available, but it is available within an environment. So you need to enter in this environment. In our cases, at the moment, it's Amazon. And then that's where you assess the data, run your data analysis, but you cannot take anything out of there. And and then when you run your analysis, you can request the research team to send the research outputs. And then you need to take care that you are not identifying anyone. Yeah. Did I answer your question?
I think the challenge is that we underestimate the potential of deductive disclosure, because you can take 5 completely innocuous, non-sensitive characteristics of an individual from a study that has, 10,000 people and figure out who that person is. So, I mean, I think that's what makes it a little bit challenging. We all try to protect our data, but it's surprising how easy it is to figure out if you know someone as part of a study. And now we're having participants, wear T-shirts with study logos and kind of advertise their participation, so it becomes more recognizable. And that, I think, is a good thing for the camaraderie and the recruitment and retention. I know Birth to 20 had birthday parties where all the participants got together. But at the same time, it's a risk for, so it's a balance. I mean, I had a participant's uncle call me on the phone and say, can I have my child's or my niece's IQ data? So I said, we can't share it, but he has enough information that if he went into our public data, he could get it. So that kind of raised my consciousness about the potential, at least. Yeah.
I think you raise a very, very important question, and we should be on our toes to be aware that, to make sure that we don't create those kind of communities. I mean, we want them to be committed, but not like part of my identity is being part of the study. Yeah, definitely.
Hi, I have a question mostly for Teresa. And this is something I was talking to you about at the break, and it's our responsibility to marginalized or underrepresented or vulnerable communities. And so, like you and growing up in New Zealand, in ECHO in the United States, we have agreements with tribal nations, which are like Maori, that we we share and use those data in a different way with more protections than we do for the rest of the cohort. But then we have other underrepresented populations that are not sovereign nations. And we both want to understand disparities. We want to protect identity. We want not to harm them in a group by saying something that's offensive to them. Sometimes we want to do analyses that bring them in with everyone else. Sometimes we want to do stratified analyses. So what are your ideas about just this whole idea of taking care of our marginalized populations within our cohorts?
That's a very good question. A tricky question, because anyway, what's the marginalized in this case? Well, specifically in New Zealand, I mentioned that, so we do have the Maori and the Pacific, and then now we are bringing together, our colleagues from the University of Auckland have created this center, which brings together Asians and other ethnic minorities. So try to increase the pool a little bit, but despite of the fact that we are a bunch of very different people or different cultures. But how to take care? We think growing up, we have also a lot of people, some researchers looking to migrant health, and trying to, but I really don't know if I'm going to have the answer to that. Yep, please.
Maybe can help you to answer this question. Under discussion, but to thinking about this, because it's important thing, because it's a special population, because most of the times, especially here in Brazil, I suppose in New Zealand too, they cannot understand very well the research in general. So my question, complementing your question, is to have some kind of a special ethical terms to apply in these special populations to protect them somehow different from the general population?
In the case of New Zealand, it's hard to say what's the general population because it's the Europeans and everyone else. But I don't think I'm going to have the answer to that because I'm thinking about what we said about identification and all these aspects. But what I see, for example, within the study specifically, it's about the governance of the data and or data collection in that space, who is engaging with whom. But I'm not talking about the very, very small groups because that's, I don't know, I don't have the answer. We have too many ethnic groups in New Zealand if we start. If we disaggregate, if we use our protocol for ethnicity in New Zealand, we have at the 4th level, we're going to have more than 200 different ethnicities, and we are 5 million people. But if we talk specific about, for example, within the study, Maori, Pacific, and Asian, which are the 4 major ethnic groups, we do have this lead, not only interviewers engaging, Pacific, Maori, and Asian engage with the respective communities, and also the Pacific, Asian, and Maori people connecting, being leaders in the relationships of the cohort with those communities as well. But I still know that I'm not answering your question, but maybe Siwe is going to have the answer.
No, I know. And as you said, I think it was just discussing. I think it's just very meaningful that we can add all these different nuances. It's about the small, like the marginalized populations. It's about ethics, about the statistics, and there are so many aspects of all cohort studies that I'm really glad that we have had the opportunity to discuss. Yeah, so I more appreciate the input rather than want to answer. Yeah.
You know, we have an ethnicity in America called Hispanic, which is, it's not really one ethnicity, but sometimes we lump everyone under the Hispanic rubric. And sometimes we say Puerto Rican is different from a Dominican, is different from a Colombian, is different from a Mexican. So there are all these questions, and yes, there's no one answer, but you know, having some principles under which we operate is good.
Just to say with my DOHaD hat on that, and I mentioned this to you, Teresa, in a way to deal with this problem in New Zealand and Australia. The DOHaD Society of New Zealand and Australia has just expanded to include Pacific Islanders, and it has a new name, and that the whole intention is to bring them into the community where they did feel excluded. And I think this is just to promote and to treat everybody equally is what's the most important thing, but to bring them together to prevent exclusion, I think, is really key. And then Beverly Mulhousler, who's organised this in Australia, they're having a first meeting in the Cook Islands in October this year, and to bring those people in who are keen to be involved in the research and to participate. So I just thought I'd flag that one up. Thank you.
And I'll just reiterate what I heard earlier today, which is engaging with those communities whom you include is really important for refining the research questions and making the questions relevant, policy relevant, community relevant, etc.
Good afternoon, Barbara Lourenço from the School of Public Health here. Thank you both for the presentations. I have a question for C. Regarding the task cohort. I was very curious about the participation of teachers in your cohort. And I would like to hear a little bit more on which type of questions you were directing to teachers, if these are questions specific to students of them, and how do you recruit and engage teachers in your cohort as well? Because
Thank you.
This is
So
very valuable source of information on child development for sure.
Sure. First of all, the focus is the child. So the teacher report on the child. So it could be emotion regulation, executive function. So that puts us in a position when we do studies of, for example, executive function and emotion regulation, we have both teacher and parent report. And we know that the correlation between these report isn't very high. It doesn't mean that one is right and the other is wrong, but they see the child in different arenas. So that's why we need the multi-informant approach. So the teachers were reimbursed. I mean, they did not get anything, but they were, we sent them the questionnaires that they had agreed. They get a small amount of money. And I can't remember the response rate right now, but it's pretty high. But I mean, Norwegian people are committed. They do what they are expected to do, like, yeah, simply phrased. So it's pretty good, actually. Yeah. But the thing is, of course, there were different teachers across time. Obviously, a child do not have the same teacher. So that we have to take into account. For example, when also assessing teacher-child relationships, and the teacher also scored the child's academic achievements, and yeah, a lot about quality, the relationship, the group size, for example, and characteristics of the schools, and so forth. Yeah, but I'm happy to send you more details if you're interested. Yeah.
No, just something that you guys were talking before about the minority groups, that sometimes I think that this kind of discussion about what can we do to deal with their data keeps too much inside the academia. And we do not take so much time to go to them and sometimes to ask them, what do they expect from science and from research? What do they think that should be done? What is important for them to be asked, to be investigated about them? And because of academia being in a space really for more high-income people, and here in Brazil for white people, and sometimes I believe we miss the opportunity to ask these groups, what do they expect from science? Do they expect to have their data protect? Is that what is most important to them? Sometimes what is most important to them is that all the research we do with their data have some kind of return to them. Like, we came here, you guys researched with us, made questions, but we didn't actually see any changes from the things that you guys discover from all of this, because those changes didn't affect us. It doesn't. So sometimes I do believe that it's important for us in the academia to take time and go to them and ask to them and create ways to those conversations to be able to understand what is important to them when it comes to science, because we see through a completely different optica than then.
And I think that's a very important aspect of research, and it doesn't only apply to minority groups, but all kind of groups, be it adolescents or elderly or whatever. And I'm glad that it's more focused these recent years on user involvement. So when you send a proposal or whatever you do, you have to be conscious and you have to describe how users are involved in all parts of the study. At least that has made me more aware of and dedicated to including users in the way we design and the questions we ask and how we communicate our findings.
Yeah, this is a very good observation. Thank you very much for your contributions. And just in the case of New Zealand, the case of the growing up in New Zealand, which is we cannot dive deep in all the ethnic minorities, but obviously that the study tries to listen to all the voices. And so it is, I would like just to bring the idea of co-design of the research of each data collection wave. So it's a whole process for the each data collection wave, which bring policymakers, things that are happening in New Zealand, all these governance groups that I showed you. So all the major voices for the major groups, and it's all the groups really are heard, and those things are incorporated. And then the way that you ask, the different languages, terminologies, what's needed for good engagement. So for example, I don't have the whole figure for the 8-year time point. In the 12-year, we were affected by COVID. Our retention rate was around 70% with bias, selection bias. But for the previous years, which are the years that I use a lot in the first 5 years of life, it's a cohort with a very high retention and around 90%, which is, I believe that is to do with the processes that are in place. Yeah.
I want to comment something. I loved your presentation about Norway and also how it's being done in New Zealand. And since that I belong to an isolated population with, many memories, which were very tragic about more or less recent past in their lives. So when I started in Colonia Nova, the first thing I had to do is to talk with the elderly that it wasn't the secret police of KGB coming back from Russia to take them forcibly to the Ukraine or somewhere in Siberia, probably, for forced work labor again. So this was the first thing, because they were, they had all these memories. And to go and bring something back to get their trust, I know this is really something that very, very important. In my field, human genetics is something that is not being done normally because you need genetic counseling and you may raise, some anxiety. But we are now giving pharmacogenetic results back, through WhatsApp with all those that want their information. And the results are amazing. They're really loving it. They're feeling very special and saying, oh, it was really something good, something nice in our lives that we participated in this investigation. So yes, I think it's risky. Sometimes you may have situations where you're not being understood, but so happy, I think a well done longitudinal study, you have to give something back. And you have to start with their needs, what they want to know.
I fully agree, and I'm very engaged in popular science communication, and I feel very dedicated to giving back. I mean, we have tax money funding our research, participants come. So like just this morning, I got a text message for someone who wanted me to come to a school to talk to parents about social media, internet gaming use, and we do a lot of these things. And that's exactly about bringing things, the knowledge back and contributing and giving back to the society, not necessarily only minority groups, but to the total population or those who want the knowledge.
For those who
So it
want,
doesn't count much in your publication records and for your proposals, but I think we have to, we are obligated to do that.
ethically.
Yeah.
Thank you very much for your question. And I love to listen to you because you're in a position as a PI or co-PI of a cohort. Unfortunately, I myself never engaged with the cohort directly. We have the interviewers, all these parts we have interviewers that have been collecting the data for many, many years, that kind of engagement. I was more in the side of helping with data collection, and now more like utilizing the data and trying to contribute. First, it starts with papers, working with the colleagues, and then there is the work of the dissemination of the finds to the public. That's the way that I try to contribute. And advocating, I usually end up with the story. So this is all to say that diet's very important in early life, and our food environments are not regulated whatsoever. What can we do trying to have that voice, advocating that space? And sometimes it's working with journalists and with the experts as well on how to frame the message so we don't end up we do a lot in Western science, which is this depth framework, this depth framing of the findings, and it's great to working on the positive sides and on how can we get the message out there. Thank you.
So I think we can finish with this section. So thank you, you two, for the excellent presentations for the next section.
And I have to say, I'm quite impressed that you actually still remembered something since we have eaten lunch and time.
Good afternoon, everyone. Just we are now preparing a closing remarks, and for this section, we were just thinking in having a round table and just some discussions about what we were talking about since yesterday and today, and maybe future directions. And I'm just asking here to Professor Horta.
Just to moderate, okay?
And also Fabiola is here, as Marcos is just going to Buenos Aires right now. And just thinking about what we have been discussing here, and thinking maybe we can back to other questions or to some topics again. And I invite all of you, and I'll invite the speakers to make a balance now, what we were discussing yesterday and today, and what we can go ahead from now. Please.
No. Well, I think that it was a very nice meeting, and we discussed several important topics concerning the design and then analysis of the studies on life cycle epidemiology. And I think that Linda posed some important points on the collaboration and access to data sets that you need to. Also, Matthew brought about when talking about the echo and all this challenging working with different research, and we also had in the cohort, right, this challenge, and I think that was quite so successful. And I would like to also to listen our audience that on their other point of view of this meeting.
Hello, everyone. My name is Ana Carolina. I'm a PhD candidate here at University of São Paulo. Well, if there is a message I will take from here, it's that it's very important to consider context, culture, and different settings. We all see here very different studies, all of them very important to science, and each of them had very important specificities that we should always consider when interpreting our results. So today, I can't remember who was the presenter, but there was someone that presented a work that when considered low-income countries, we could find a result, but when considered high-income countries, the result was different. So this is what we should always keep looking for. And also, I think something very important that I have realized here is that today we have a gold standard method, but we should be open for, in the future, just realize that this is not appropriate anymore. Science is not a truth that is not going to change. It's something that is constantly changing. And when we do not keep our eyes open for that, we are not anymore scientists. That's it. Thank you.
Maybe, I guess, was Lucila. She just told, yeah, she asked this morning about how it happens in high income countries. Yeah.
Ari also, when he talked about the cohort collaboration, and for example, he was talking, and Linda also, I don't remember Linda or Ari. Anyway, someone was talking about the consequences of early growth. If you take, if the first studies from high income countries suggest that even early growth was not good, whereas studies from low income countries show that early growth was not bad, and malnutrition is highly prevalent in low-income countries, then we are sending a wrong message to low-income countries, say something like, okay, we should not promote early growth. Whereas, indeed, the evidence suggests that in these settings where undernutrition is highly prevalent, promoting early growth would be not only not bad, but for several outcomes would be good. For example, for human capital, early growth has a positive impact.
I just start to have some questions more than comments, because I was thinking during these 2 days how we can improve the involvement of the patients and the doctors in the medical records, in the correct information. And because I am a pediatrician, and in my clinical, not mine, but I work just in university, we needed to teaching our students, our residents, to put the correct information in the medical records, or because Lucila talked about this first topic, that this information is so important. And we have a public health system. It's important, of course, to use the same platform to put this information and put the correct information, because it's so important. And the second point that I was thinking during these 2 days is how we can involve more the population in general, that to put value in this type of research, because it's not easy. I listen Barbara talk about MENA follow-up. It's very important to connect with the families, connect with the children. I can imagine how many histories you can listen when you talk with your patients. And finally, we need to talk with the governments, that we put the correct information in the guidelines. And I have a question to Lucila. Can I? I know that in NHS, the general practice needed to put, if I saw a patient, I did a prescription for something, and the government need to pay, is a public health system. We have here in Brazil the same, but we have a part of public health system, and the other part is a private or supplementary health system. Me, like a doctor, if I do a prescription, sometimes the patient will receive the drug, the medicine, or not, depends. But for example, in this situation that we have now, increase of obesity and increase the use of the drugs like GLP-1. And we know that the guidelines here in Brazil is not a free, the people need to buy. But I don't know if, for example, in UK, there is a protocol to use this. But if the patient asks, I would like to use your, I will find or search for something can do this prescription for me. This information is not inside the chart, the medical chart. It's a very hot topic for me.
You've put your finger on a very important problem in obesity at the moment. And in the United Kingdom, women are getting access to GLP-1 agonists on the internet, and it's not recorded in their primary care data or in their hospital data. And in relation to pregnancy, are losing weight rapidly and becoming pregnant. And we don't know about the safety of these drugs in pregnancy. They're currently contraindicated in pregnancy, and probably for good reason, because the animal studies suggest changes in placental function and so on. So we have a really big problem, and it's one which has been noticed in the United Kingdom. If people have been prescribed and they become pregnant, then that is notified on a mandatory register, but we're not getting that data at all. So I know somebody in the United Kingdom last week sent out a sort of Delphi audit to see how we can get this information, and we don't have it. It's one of the biggest problems facing us at the moment, and also quite challenging in terms of safety. But if a drug is prescribed in the United Kingdom, then even in the private sector, the private sector has responsibilities to tell the general practitioner that that person is registered with a general practitioner. So we do get quite a lot of the data through, but private medicine is generally still very small in the United Kingdom, and particularly in antenatal care, the vast majority of people go to the NHS. The small fraction, and most of the people who go to private obstetricians are coming in from abroad. So that side of it is not a problem, and we do get very good prescription data. But you're right, there's this big problem we have everywhere, I think, about pregnant women, and particularly in relation to in vitro fertilization. Certainly in the UK, they're advised to lose weight before they're allowed to have a free cycle of IVF. And so they come in with a BMI of over 30, they will not be treated unless they lose weight. So they go off and get the drug on the internet. So that's, I don't know whether anybody else would like to comment on this here, but it's a burgeoning problem that we have.
Thank you.
Thank you.
Any questions or comments? We have some. So I would like just add another point. It's about just doing consortium work, or just how to plan, because most of the cohort study, mainly birth cohort studies, have been set in high income countries. And we should just improve. Of course, in Brazil, we have a good example with very good cohort studies here, but it's not the same for example, in African countries, or maybe in Asian, we have some. And how to deal with this, how to help each other and improve and make more exchange about the higher income countries. Research is just set in high income countries with other areas. And just facing this point, I would like to ask Isabel, because Isabel, one of the reasons why we are here together is, of course, because of Fabiola and Bernardo and Marcos. They invited me to organize all together this meeting, but we are just starting thinking. We have been in the Mina Brazil study, provide some information for our study and join other pooling data projects. And this is a huge work. As we had this morning some presentations about this harmonization data, and also, and Isabel, just as a brave woman, she just took this challenge and just combining some information from Mina, the Brazil study, and Pelotas, and other cohort studies in Brazil, in other places. I would like to ask you to talk about some difficulties and challenges, and how it's going on. Maybe just a good opportunity to, because this is a very important point in my impression, to go ahead now. from what we have been doing here.
Thank you for the opportunity slash brecha, Marty. But I started my PhD working with Mina Brazil data and studying social inequalities and breastfeeding and the association of this with child behavior problems. And then it's available data and it's an amazing data, and I have been collecting data for a few years. But we realized that it was not enough to answer what we really wanted to understand, that is the role of social inequalities and breastfeeding on child behavior problems. So then we started to talk about the possibility of comparing the data among other cohorts. So the network started and we started with the Pelotas cohort because my co-supervisor is Professor Alicia and Professor Bernardo is also collaborating. And then Marley told me about Sia's project. So we started a huge connection with this amazing birth cohorts and other cohorts that had this same data that we also had. So they had data on maternal education and socioeconomic status using income or richness index, and also the SGQ. So we saw so much potential in these amazing cohorts in all over the world that were using the same data that we needed to compare. And well, we had some preliminary results and it is different among the countries. But it is a challenge because some of the data you have to unfortunately go to Norway to do it. And some others you have to make agreements to take it. Some others, the data dictionary, it's not very good. So you have to go into the questionnaire that they use, the paper one, and see what kind of question they actually asked for the person and who that person was. Because the primary caregiver is not often the mother or the father, or it can be the grandmother. So the comparison is very hard, but there are strategies to do that. Professor Bernardo has helping us a lot with this because there are strategies to compare this data. They are not exactly the same, but they are still very valuable to compare. And another thing that is very important to mention is that the determinants of a lot of factors are different among the countries. And breastfeeding is an excellent example of this, because if you go to high-income countries and low-income countries, the determinants of breastfeeding are different. So they have to be taken into account when we are studying these different settings. So yeah, it has been an amazing opportunity. We hope to have some final results very soon. And I'll be very happy to share this with you. Maybe in the next symposium, please give your feedback.
Kudos to the organizers for the way that you have incorporated the students into this meeting. I think we're all just incredibly impressed at the work that's doing, but we're responsible for, kind of socializing and growing the next generation and people that have these perspectives. And I think this has just been particularly effective in bringing that in, and I hope inspiring them to, continue this collaborative spirit that you develop by having this kind of meeting. So I think that's one of the things to really mark as a big success for this meeting is the incorporation. And also, I would love to know what the formula is for how you are teaching this cohort, because they're phenomenal. Is there something about the Brazilian education system that is producing such amazing high quality work?
Yeah, I have one comment, but
Lucila,
I think the hands. Just a comment, Linda. I'm required to say that you are in charge with us just to follow up them from here. We really hope to stay connected for the next years or whatever. Yeah. Once you are here, we are expecting just keep close relationship, maybe exchange students, what we are. This is one of the most important purpose of this meeting. just exchange and improve knowledge and support our PhD students from Brazil, from Latin America and other countries. We have also here some African students. So how we should just be connected in this area, this topic. I hope so. Yeah.
Thank you. I was just thinking about harmonization, and we started off the conference with me talking about the routine healthcare data and it being as an effort to be harmonized across the world using the OMOP system, which is burgeoning. It's in Europe, it is very big now. Millions of data have been harmonized using this system. So it's not, totally blue sky thinking to suggest that ultimately you would use a similar system in birth cohorts to code them. So each of these fields could be coded. And you could almost do that. So if you're looking at these different cohorts and thinking that the same fields could be given a code. And the advantage of that would be that with similar codes that you would have in the routine healthcare data, so that you could interchange the routine healthcare data for the cohorts. And certainly what I would like to do, and we are planning to do that, for example, to do intervention studies in preterm birth, which we do, we would like to follow up the children. But you have terrible attrition and so on if you invite them back to the clinic. But a lot of that data will be available in our healthcare system data. So the mental health data, the visits to the GP, the prescription data. You get very, very granular data for those children as they grow up from the healthcare record. And of course, it's complete because they will be there forever, at least where we have the NHS number. So I think it is feasible to do that and to think big, that ultimately we're going to carry on doing these cohorts. They should be harmonized in a way which can interact with the healthcare record as well. And certainly in Brazil, that would be absolutely feasible because Brazil is absolutely top of the world about using electronic health records. So I just think it's blue sky thinking, but at the end of the day, think how easy it would be. If you could look at a cohort, they wouldn't have put all of the fields in, but they would put a certain number. They would be coded up exactly the same code as everybody else was using. Because unless we do that, it's just going to go on being incredibly difficult. You've got to look at the data dictionaries. You've got to look at the individual questionnaires, this harmonization of questionnaires and so on. I mean, it's not impossible. It's a huge amount of work, but that's ultimately, wouldn't that be lovely to do?
There are a couple of precedents for this. Closer in the UK put together the data from lots of different cohorts and made a metadata catalog available to users. There's another group in Canada that's done this for a wide range of surveys. I think one of the challenges that they faced is funding, because it's expensive to put them together. And it's not something that's necessarily at the top of the list of our funders. But and there are also precedents with the WHO growth database and the international food dietary database, where people have put together the data from many, many different cohorts. You can do pooled analyses, but it takes big resources, unfortunately.
So maybe just talking about funding, maybe Matt can add some ideas.
I think, Marley, you just asked me to talk about funding, and I'm going to change the subject.
Nice,
You know
nice.
how when the media ask you questions, you say, that's a really interesting question. And my point is, I want to just say that I so appreciate being here. I've learned things about, from very specific things about trajectory modeling all the way up to the grand things that we're talking about right now, which is how to solve problems in human health, especially maternal child health. And I too want to recognize all the students that are here and how excellent their, not only their presentations, but their questions and just their presence is. We really feel like supporting the next generation of researchers is really key. So I'm so glad you're doing that. I think that, we've heard about a number of individual cohort studies in Brazil, as well as some coming together of cohort studies, and then some more nationwide cohort studies from other places. I think there is a remit to try to, as we're saying, I think we're all saying the same thing about working together so that we can either harmonize data or standardize data or look at variation across studies so we understand some variability, some heterogeneity. But I think this is really important, and I think we're all agreeing about that. So, and thank you very much for your hospitality. You told me I couldn't say that until the very last day, and this is the last day, so really appreciate it. You, Marley, and the whole group have been marvelous.
I have just a comment about
Okay.
not funding. I'm not comment about funding, but I'd like just to talk one thing about the new generation. I'm not so new. Was wonderful because it was wonderful to watch the works of the students here. I was impressed because I know a lot of cohort studies. I'm not directly participate of them, but it's wonderful. The future is now, but I have a challenge for the younger generation, I think. We need to improve our communication with the population in general, because it's related to funding, it's a political strategy. And when for example, when I am listening a paper, MENA paper or cohort paper, the papers in general, it's very important scientific situation to read of the risk of the increase of disease. But when you translate this information for the population, I think it's important to put the protection is, because the good communication is the communication, what I can do, not just for example, if you don't have a breastfeeding, they increase your risk of obesity. Okay, but if you do, you reduce the risk. And after that, how you can do that? The scientific information needed to do this translation, because we needed to support the importance of science here in Brazil and the other parts. And it's very important for a new generation to do this translation for the population in general, to engage the population, to participate, to engage the government, the importance, what you can do is the same information, but the way that we can do that, to put the correct way to inform what you can do, I think it's very important now and the future to be more important.
But Lucila, we are already being requested here in Brazil to present this kind of plan. The Brazilian Research Council in several grants has asked the applicants to present a plan of communicating their findings to the society, not for the scientific people, but the society. The amazing, because I'm also several times I'm working at the committee that evaluated the proposals, and this is something we are right. We need to discuss this with our communities, the research groups, because in the last committee, the last time, several groups, several proposals, what they present as the way of presenting their results to the community was publishing papers. And publishing papers does not mean communicating with the society, okay? And the health minister did the same with in the last funding of our consortium of birth cohorts that involves Pelotas, São Luís, and Ribeirão Preto. They also asked us for a plan. We need to present a communication plan to the society, and even they allowed some money to support communication people that's working in social media and all this communication. About harmonization, I think that the Brazilian consortium, we learned, as I was coordinating the previous round of the funding, now I passed away for the next generation, right, Antonio Augusto? Fernando is now in charge of leading the project. But what we learned is that, okay, there are things that happened in the past. We cannot go back to the past and change and then we need to try to harmonize as much as possible the previous. But we can plan the next waves of collection to try to get as much as possible to measure the same variables as much as possible using the same instruments. And of course, that comparing different settings, even in Brazil, it's amazing. I remember that I think it was Antonio Augusto that I called. One of my students was comparing the changing maternal smoking, the prevalence of maternal smoking during the pregnancy. And the data from São Luís was amazing because the prevalence was quite lower. The highest was in Ribeirão Preto, and Pelotas was, we had the same trends, Pelotas and Ribeirão, higher prevalence, and in São Luís was below 10% or something. Yeah, my first reaction was, it's wrong. And then I remember that I called and Gugu and Antonio Augusto, this thing is wrong. And they said, no, Bernardo, it's right. And then I went searching for other data from community studies, and all the studies were reporting a lower prevalence in the northeastern region of smoking. And this is, yeah. Yeah, this is something that in Northeast and North Brazil is different from the South Brazil.
I'd just like to, again, with my DOHaD hat on, speak to you guys here, early career researchers. I don't know how many of you are coming to the meeting in Buenos Aires, but we have a morning on Sunday, which is for early career researchers. But the International Society is really wanting to speak to you all. And we've done a bit. We have started workshops on methodologies appropriate to DOHaD. So they are free to a number of people from low-income countries, which includes the whole of South America, for 10 places for each of the workshops. We have been doing some statistics workshops, and I think from speaking to quite a few of you this week, that is really important because statistics is moving so fast. We had some really good thank you very much for your comments this morning about mediators, confounders, about SEM, about longitudinal modeling. I mean, there's so much around at the moment. We'd like to extend those courses that we do on statistics, but we'd like you to tell us what you would like to have courses run on, because we can put them on. We have the facilities to do that. What's more, if we capture the lectures, we can put them online, as they are all online on the International Society website now. And it can be a really good resource. So that's what the Society exists for. It's to not just to have a congress, but to help our researchers across the world. So I think you know who I am. I'm Lucilla Poston at lucilla.poston@kcl.ac.uk. There's an admin email on the International Society website. Please let us know what you would like to have courses on, because we can do it. But we also need to know who the lecturers would be. So if you have some recommendations. Now our courses are run from a guy in Harvard who's helping us to do that. So he would then get in touch with you and organize it. But it's a wonderful opportunity to speak to you all just now to see what you would find useful. Because I know across the community in the UK, statistics is something everybody has to learn when they're doing DOHaD work, but they don't often have the opportunity to have the mentorship for statistics in their own departments. But not just stats. What else would you like to know about? We have a course on qualitative research, which is run 3 times a year. So, but you have to be a member to join up. But it doesn't cost anything to be a member if you're in a low-income country. So all you've got to do is go online and do it. So there's the resources there, and the resources to be expanded to help you. So let us know. Please let us know. But we will expand the statistics workshops and courses. Thank you.
And I think this is a important topic that Lucilla is talking, because we need to improve our knowledge in these topics, and it's very important to connect with websites and ideas. And I would like to say thank you to Lucila, because 1 year, no, I don't know how many months. The first time that Marcus talked with me about this meeting, he talked, Lucila is thinking about something about cohorts in Brazil. What do you think? I think, oh my God, I am not a correct person. I can help, but I asked to Marli, you can work with us in this project, and this project is real. And thank you to Bernardo too, and everybody, because it's like a dream, because we had 2 days with very important persons, senior research and young research, talk in the same way. And Professor Lucila is like a mental coordinator about this idea, and we participate of this. Especially thank you so much to Marli to engage involved in this project. So it's wonderful, wonderful. And I would like just to say thank you. So everybody to participate here. We have epidemiologists, clinical base, pediatricians, people that work with the obstetrician. So the connected, these ideas are very important for everybody to understand the way. If I don't know a lot about statistical, for example, but I can understand what happened, what the movement of the science. So it's wonderful when we had 2 wonderful days.
So just after you. No.
So my name is Helena. I forgot to present myself yesterday, so I will present today. My name is Helena. I'm from Federal University of Rio de Janeiro. And after Linda comment, I was reflecting now. And as a Brazilian researcher, I think that an important thing that we have here in Brazil in our education is that we have a commitment with the public health. I did my undergraduate degree in University of Brasilia, my master here in School of Public Health, and now I'm at Federal University of Rio de Janeiro. And I think these 3 universities has a thing in common, that is they are public institutions, and they are all have a commitment with public health. So we do research for the people, for the public health. So I think that this is an important thing when changing with other countries, because I don't think that some countries do the same. And I think that we should always do research for the people, not for our egos as a researcher. And so I think, Linda, as a Brazilian researcher, I think it's something that we need to be, not aware, mas orgulhoso is proud. Yes. And I agree with you that these 2 days was so awesome to be close to high quality researchers that sometimes in bigger Congress, we don't have these opportunities. So this is an event that is small, so it's easier to have connections. So that's it. Thank you for all.
Can I compliment Elena? So I like to translate a lot of Brazilian expressions. I love to do that, like complaining with the belly full. I love to do that. And there is an expression that I use a lot in English, which is that we take milk out of the stone, which a lot of immigrants understand when I say. And that's what I asked about for Teresa and Cia about the role of considering researchers as a job. as like a formula, and that's a very important thing when we think about funding. And to do this job that I'm doing, the consortium, for example, I spent a lot of money, and I needed a lot of funding to do that. And fortunately, I was able to get it. But I don't think that's a high priority right now in Brazil. So, but it should be. So, just wanted to this provocation.
Just talking about this, of course, we in a special situation here in São Paulo State because we have FAPESP, the São Paulo State Research Foundation, and we have more money than in other states in Brazil. And I'm really happy here and proud of just see some students from other states here doing an amazing work. Because we know even for us it's challenging, but we cannot complain if we compare with other states in Brazil. Yeah, because our students, they have scholarship, they are just doing internship outside in other countries, just supported by FAPESP, but this is not the same situation for other students. So I would like to listen you about this experience and just how we can just keep connection and just make some exchange in data analysis and also other kind of pooling data or whatever we can do in the future from what we have now in this group. So this is a special situation for us in São Paulo. And we are really glad to share, to give you this opportunity to stay together and try to make our best research, mainly in cohort studies. And what I also should say, maybe I'm just here in this position, as Fabiola just said, and Fabiola and Bernardo and Marcos was like, you are in charge of this. But I could learn a lot from my colleagues in Pelotas and from cohorts. And Barbara here is my former PhD student, now my colleague at the same department. I have another former PhD students around the world. And we could learn also from Professor César Victora, Professor Fernando Barros, and my colleague in my department, Professor Carlos Monteiro. So this is quite important. What we are doing now in Brazil, it's just because of you, from Marcos Barbieri here. It's a great pleasure to have you here during these 2 days, because you are very important for just keep the work going on and change and exchange experiences. So we are not alone. No.
I would like obviously to say thank you to everyone who is here today. I'll start with Marli for the beginning of this conversation last year. Obviously for the whole team who was involved with the organization of this event, for meetings, a lot of amazing researchers at all stages of career, and especially discussing things around cohort studies. It's amazing. Anyway, I'm living here with very happy and fulfilled. And then when we continuing what your conversation, what you said, Marli has been saying, obviously that on the side of New Zealand, we have a lot of interest in collaborating and obviously hosting these wonderful researchers, also coming to New Zealand, establishing more mobility in that space, because we have a lot to learn, contrasting the different realities. And I don't know if it's a lot of push, but thinking in terms of research scenarios, and we Brazilians, we tend to believe that things in high-income countries are always amazing in terms of funding. I can say that at the moment in New Zealand, things are very tough, very tough, very hard. And how about thinking of international grants together? doing different observations in different cohorts. Sometimes we cannot bring the cohorts exactly together in the same data set, but even some meta-analysis, some very important talks, I think we can bring those, and there are some international fundings. I'm not saying that it's easy to get them, but it's something that eventually we could start discussing as a group as well, in any space that we think that's relevant. Yeah. Thank you.
No more questions or comments? Yeah, maybe we can just close this symposium here. Once again, we ask you just to fill up the questionnaire. Just you can just either reply in Portuguese or English. The questionnaire is in English, but please be free in either languages. And we maybe will just follow you in the by emails, just to keep in touch, maybe planning other activities in the future. Next year, we're gonna have a National Congress of DOHaD in São Paulo, here at the University of São Paulo. And so this could be a very interesting opportunity. Maybe we can just planning some pre-congress courses or seminars or some activities. Just keep this group, as Lucila just inspired us to keep just thinking in cohort studies with this approach in DOHaD and the life cycle epidemiology. And maybe we can just thinking about some talks, what we were discussing today and yesterday. And we have another talks, for example, ethical issues and just combining data from different countries and different settings. This is a huge problem, especially in European countries. In some cohort studies, when we are using health system, the official health system data, not exactly individual studies, just the public, using the public data, but it's not exactly public. Yeah, and so we have some issues about this when combining data from different cohort studies. And so this is some ideas for just to keep you in touch before next meeting. Yeah. If maybe, Fabiola, you can just say some words for just closing remarks here.
Yes, I think we will have a next meeting in USP. Marcos is working in this, and the idea is improve the connection with clinical and basic and epidemiological data with this type of discussion. And of course, we will have a great opportunity. I think now to be something to continue this discussion we start now, because I think it's just a one step. We need not one, but which one step. The next week we can increase our connection, discuss ideas, and discuss something like Bernardo told for us, how you can improve the connection and put the results outside of scientific region like that. So I am inviting everybody to stay with us here in São Paulo, in USP, to participate of this symposium. DOHaD Brazil is related with Latin American DOHaD, and Latin American DOHaD is connected with international DOHaD. So will be a great pleasure to see everybody again. And now I just start to invite Marli again to work in something to the next year we can do together in the same line. I think it's a great job you had, and it was my pleasure to work with her. I admire your work and your students, the students that here. I would like to say thank you for the students that working outside, recept us, so kind, talking, so worried about everything, okay? Not just inside, but outside of the room. Thank you so much for everything here, that we work together. This is the principal word.
Fabiola is just saying, because she's also in the scientific committee of the symposium as Bernard as well. And we have also a local organizing committee with my colleagues, Barbara and Alessandra here, also professors at our school here, and Professor Alicia unfortunately got sick these days, and she was helping us a lot, very excited about this meeting. She has been working so hard on this area and these topics. And also, I will again talk about the local organizing committee as we have here. So most of them are PhD students. Liane also a research also from our department here. I'm not alone. I'm always with a very large community group and also supporting what we are doing. Otherwise, we cannot do. I'm not here because I just got this way by myself. We are always supported with so many people. And I would just say a special thanks to Isabel. Not only, of course, all of our PhD students engaged and involved in this task here, but Isabel was just doing an amazing work, just helped me a lot, now more close in decisions and everything else.
My pleasure.
So thank you very much. Lucila, do you want to just talk a little bit about the International Society of DOHaD Society? Yes.
I did mention this at the beginning. I don't know how many of you are here, but the International Society is changed quite a lot in the last few years. We've been working very hard at reorganization and the regional groups. I mean, obviously LA DOHaD is our star group, and we've got subgroups within LA DOHaD, but I don't know where they all belong, but it's fantastic. I mean, you must have seen the seminars and the webinars and everything that is being organized on a weekly basis. They've done a wonderful job with organizing the meeting in Buenos Aires, and it's going to be fantastic. The society, obviously, the early career researchers have been left a little bit adrift recently because we haven't had anybody to lead them, but we've just advertised again for the new leadership of the ECRs, and we've got some very good applicants. So we will be deciding very soon, and I hope it will get galvanized a bit. But we will be sending some communications out to you during the meeting and after the meeting. For example, what would you like to have training courses about? We have Brain Mobility Awards as well, which means you can go and spend a few months in a lab somewhere else. They haven't been terribly well subscribed to this year. So, we're very keen to give our money away to people like that. We have some travel awards and so on. So look at the International Society. What has happened over the last few years is that anybody who becomes a member of a regional group is automatically a member of the International Society. So we're all one big community. So we know exactly who belongs to each of those groups, and we communicate to them all. So we've now got a very good communications officer who's sending out stuff all the time on LinkedIn, on various feeds. We're going to wean ourselves a bit off Twitter in the future. But we do have really good communications, and we really want to help early career researchers in this field. That's my primary aim as being president over the last few years has been that. And we have got these training courses and workshops going, but we want to hear more from you as to what you would like. So please, come forward to us, and we will arrange. We have a subcommittee that does professional development, run by Isidine Aris, who's in Harvard, who's got lots of good contacts. I should be, after this meeting, if you don't mind, getting in contact with people here, yourself, Marley, and Linda, and Arnie, and Matt, to suggest people who might be able to give some junior lecturers who might be happy to do a seminar for us or a webinar on a certain topic, because we're limited. I have my network, and in fact, most of the short courses are run by my staff. So we need to expand that. So we'll be asking you, both you, is what you would like, and then the senior membership as to how they can help get it together. So in the next year, I'd love to see lots more of these training courses. I'd like to hear from you all. Please join the ECR groups and join in when you go online and join. If you haven't joined, it's all there. And then you make use of, there's a huge library of lectures and resources that we have already online. But I hope you will find the reorganization is to your benefit. And that's what we want to do. And that's what I want to hand on to the next president when I eventually go, which won't be very long from now, to help you in your careers. So thank you very much. And Marley, this has been a fantastic meeting. It really has. I mean, it's apart from the fact we've had the most wonderful hospitality. I love meetings like this. I would rather come to a small meeting like this and sit down and talk to people who all know about the same thing, and we can talk in detail and have really good discussions. This is my idea of a wonderful meeting. So thank you for making that possible, Marley, and all the team and all the students and Matt and everybody who've come and contributed. We've all enjoyed it. It's been really good. And so Buenos Aires is going to be something else and fantastic too. The early career researcher morning, and then wonderful speakers from all over the world. We've got the opportunity to listen to them, and a lot of that will be going online afterwards. If you can't come, we will have a lot of the lectures online available to you. Is that right, Marcus? Is he here? Afterwards. But yes, that's the idea. Not to the same time. It's not a hybrid meeting, but there will be some of the content available afterwards. So I hope you benefit from all of that as well. But it's been lovely. Thank you very much for everything you've done for us. And I know it's been a lot of work and you must be very tired, but thank you very much. Thank you.
Thank you, Marley, and thank you to all this committee and also all the students and all the presenters. I think you just keeping just in time everything, the presentations. You are so great. I'm proud of all of you here. Thank you very much. Yeah. You too. Let's take another picture. Yeah.